right now it's really word of mouth, which is good that that's an option, but patients perhaps don't always feel comfortable talking to their provider about their finances or that they can't afford a medication, so they just stop taking it. But if we were to be able to advocate on our end, like, yeah, we have someone that can help you free of cost, I think patients might be a lot more apt to be like, oh, yeah, that would really benefit me.
Hi, everyone. Thank you for joining today for another episode in the Pharmacy Technician Career Pathways. I'm so excited today to have Julia Lee with me. She's a certified pharmacy technician who is a patient assistance and revenue associate. Thank you so much for joining today, Julia.
Thanks for having me.
Absolutely, it's a pleasure. Let's just jump right in and start off by having you tell us about yourself and what led you to pharmacy.
Sounds good. So, hi, I'm Julia. I work in patient assistance and in revenue in the pharmacy admin team at Essentia. So, what got me into pharmacy originally, my grandpa was a pharmacist, and I have cousins in pharmacy and an uncle in pharmacy, and it just seemed like a natural pathway. And then my parents were also small business owners growing up. So I think that had a lot to do with what brought me to where I am today. In my work that I do now, I assist patients who cannot afford medications. I use manufacturer-based programs to find what they need. And then also my revenue portion of my work is working with revenue, like it sounds like. So making sure, all of our accounts receivables are done and getting patients their bills. But it's interesting that it ties well with my patient assistance. I've been able to do payment plans with patients as needed, which is brand new. So that's been kind of cool.
Very cool. We'll delve in a little bit more into your current work and what that all entails. Once you knew that you were going to pursue pharmacy, what training and experiences you explored to get involved in the field? For our viewers who may not know what it takes to become a pharmacy technician in the first place.
Good question. When I decided I wanted to work as a pharmacy technician, the first thing I did was I went to Half Price Books in Roseville, Minnesota, and I got a book and I was like, can I do this? Is this interesting? And yes, and yes. So that was the first thing I did just to see if I liked it. There is a 2-year program you can do as to get a pharmacy tech degree. I don't think that is widely pursued. I think a lot of my peers start out with their 4-year biochem degrees and either stay in pharmacy or may pursue their doctorate in pharmacy later on. After I decided, okay, I can do this. This is interesting. I'd like to continue down this path. Once I got my job at Essentia, there's a 1-year training program through Pharmacy Tech University, and that is required at Essentia, and I think it's required at a lot of places. It was fantastic. It was a great training course. You learned the foundations of what you needed to do. As a lot of people know, you have to do continuing education, all the time. So you're constantly learning, and that is expected of pharmacy technicians as well.
I loved hearing how you got interested in pharmacy and what you all explored, especially knowing what you're doing now. After working a few years as a pharmacy technician, what initially motivated you to pivot to pharmacy administration and going about that route? How did you pursue that?
Good question. I started out in the inpatient pharmacy at Essentia Health, which is bustling to say the least. It's a busy place to work. There's a lot of different aspects of pharmacy there. So I think I was introduced to a lot, and I met a lot of people too. I was offered to work in a couple different meetings. So we're building the new hospital, and there was a pharmacy process team to help build the new pharmacy, and I got to meet some of our Epic contractors, and I learned there's so much more to pharmacy than just being a technician, although it's very important and it's great. I found that I wanted to pursue maybe more the behind the scenes, the back office, business portions of pharmacy. And so that's what I started pursuing and talking to folks to find if there was an area for me like that out there.
Very cool. There's so many different paths pharmacy technicians can go. It's not
Yeah.
always that traditional frontline dispensing, delivering type of role. There's so much more to explore. So I'm glad you realized that and, found what was the right niche for you.
Yeah.
So after all that fantastic background, I'd love to hear more about your current role, and I'm sure our audience would as well, as a patient assistance and revenue associate. For those who may not know, can you provide us with a high-level overview of what patient assistance programs are and your more detailed role with them?
Sure. Patient assistance programs are programs that we try to offer to patients who do not have means to get their medications. The whole goal is to make sure patients are adhering to treatment plans, are using preferred medications, and then ultimately can afford them so they can stay on their routine. Patients shouldn't have to choose between groceries and paying bills and their medications. So, patient programs evolved. What I do is I assist patients using manufacturer-based programs. So where I work, we work for a nonprofit. Being able to fund programs like this can be often difficult. So we use other programs that are already funded to help our patients. So that would be manufacturer-based programs. I get referred a patient. Someone will send me a message in Epic, usually a provider or a nurse. It could be a pharmacist or a technician themselves. Everyone and anyone can message about a patient who might be experiencing financial difficulties or having difficulties sticking to their medication because of price. After that, I will look for a program. I usually use Needy Meds. They update constantly, and there's thousands of medications on there. I will find a medication program, reach out to the patient, and they'll be like, "Hi, this is Julia from the Essential Pharmacy. I found a program for you." And you will never, it doesn't get old hearing the relief and the vulnerability, and just people are really happy. They're so excited that there's something out there for them that will help them stick to their meds. Like, they're just so happy about it. So from there, I will fill out an application for the patients. I usually get 90% of it done. And I highlight, what needs to be done yet. Most of these programs are based off type of insurance, income. They will look at how much you spent at the pharmacy sometimes too. So some patients have to pay 3% out of pocket or 4% out of pocket before a program will assist them. So we'll walk through that, just learn the process with the patient. And not a lot of people know what to do. So making sure that it goes smoothly for them, it's as hands off for them as possible. It's, yes, I need this med. Okay, sure, the pharmacy can help you get that. That's what we're striving for. We get applications mailed out to the patients, and then I'll also take care of the provider portion. So I will usually interoffice mail or fax to the provider. At the end, everyone gives their application back to me, and I send it off to the manufacturer and await results. Once we get those results, then we work with the patient again, make sure medication gets to them. So a lot of times these manufacturers will want to send the medication to the clinic, which can be messy. I oversee 72 clinics, so it's like, where is this med going? And our process at Essentia is to make sure that meds are checked and labeled, just like any other medication being dispensed from the pharmacy. A process needs to be written that medications go from a clinic to one of our pharmacies and then to the patient. So it's done safely, and just like any other med, hopefully, that we'd be dispensing. But that's the high level overview, I suppose, of that question. So
There's a lot of different components involved, that's for sure, but
yeah.
you did a nice job summarizing that. We actually have some questions from our viewers in a little bit more depth to better understand some of the aspects of your work. So you had mentioned one of the programs that you tap into for some patient assistance. How do you learn about all the new programs that are out there and available for patients?
Communication is probably the biggest way I learn about new programs. I work with all of our endocrinology teams and neuro teams, oncology. I work with our specialty pharmacy and our patient educator. Everyone seems to work together, and if there's a new med, simple as sending a message, hey, do we have something for this? And it's just doing the research. A lot of it's research and trial by error, I suppose. But I told you earlier, I use Needy Med's website, and they update frequently. So that's a very helpful resource for finding new medication programs, at least useful for me. So.
Absolutely. Having a centralized database, I'm sure, is very helpful.
Oh, yeah.
Our next question here is regarding the types of assistance programs that you commonly look for.
That's a good question. So I think mainly I work with endocrinology and neurology. Our behavioral health patients, I've been seeing a lot more, and that's been really awesome. Something interesting. So I feel like the majority of my work has been based outpatient, and in the future, we're looking to be more inpatient. In our programs, it'll be new, but we're starting that transition now. We're seeing getting medications for NICU babies and patients that can't afford their meds while they're inpatient. So that's kind of pivoting a little bit.
Very nice. And I agree. I think the patient setting should not impact their ability to receive this type of support and assistance. You know, our health is our biggest asset in life, and receiving quality care definitely is a part of that. And medications are a huge component of the care in which we receive. So that's amazing that you're expanding to different patient settings outside of the outpatients.
Yeah.
That's amazing. Next question here. What do your patients do if these patient assistance programs are discontinued?
That's a good question, and it's a hard question because sometimes it's not very pleasant, but it has happened. But generally, when patient assistance programs are discontinued, it's maybe because a generic is now available. So hopefully we can get the patient med switched over if that's the case. If that isn't the case, which I've experienced also, this is kind of where the revenue part of my job comes in handy. A lot of times, if a patient just needs help reaching their deductible, and then perhaps they can afford their medication after that, and it seems appropriate, I'll work with the patient and do a payment plan. So if they need, to pay $500 or $600 out of pocket, I'm like, all right, let's come up with a plan that you pay $100 a month or 50. Sometimes it's 10. As long as we're working towards a goal, that has come in handy. Another way we try to combat that would be looking towards maybe a copay card or something that will try and bring down the copay price at the register. And then also as a last resort, there are just like a needy meds coupon, and that can help. But more times than not, I think patients have to change their medication. And unfortunately, that's not the best option, but for now, that's all we have.
Yeah, hopefully we'll get to reduce drug pricing, but sounds like to be the reality of what the current situation is. It's amazing to have people like you who are in these positions who can help patients get on these programs to get the quality therapies that they need.
Yeah.
But alas, sometimes some of the programs will discontinue. So
Mhm.
that's good to know what actually happens in practice, what you're seeing. All right, just a few more questions here from our viewers. What other prescription assistance is available to patients in addition to patient assistance programs? I know you mentioned a few just now with copay
Yeah.
cards. Are there other resources that pharmacists, pharmacy technicians should be aware of?
So I think the most common programs I see are the manufacturer-based continuing need applications that's what I do the majority of, the copay cards and perhaps coupons. But in Minnesota, the Minnesota Insulin Safety Net program started in July, and that's been pretty huge for our diabetic patients. That allows patients who have a copay of $75 or more who can't afford it get their meds at $35 at any pharmacy in Minnesota. The more we highlight how patients are having trouble affording their meds, the more programs will come out of the woodwork like that one. So that's one example. I think Minnesota is leading in that regard. The only other thing I can think off the top of my head would be some kind of repository system. I know Minnesota is able, but I don't think we're practicing. Wisconsin, I do know does the repository type work. It's just messy. There is an essential database to know who has what medication, so it's a lot of calling around and manual labor, which is just messy right now. But there are a couple other options. They're just maybe not as easy to utilize.
That's great to have you as a resource. You are a repository in a sense of all of these different programs, knowledge of them, what they all entail, how difficult they are to navigate, and being able to help patients pursue them and go through them. Cost should really not be a barrier. So that's great to hear of all of the different options that are available. It's not just the traditional patient assistance programs when we think of them.
Yeah.
And last question here, it's a bit of a broader question. What do you think is to come in the future of patient assistance programs?
So I'm excited for the future of patient assistance. Right now, I am working just in the East market, but I have plans to expand to our West and Central markets, which will obviously hopefully reach a larger portion of our population. And then with that would come marketing to our patients that we have these programs available. Right now, it's a lot based on the patient. If they bring up to their provider that they're having a financial issue to get their medications at the pharmacy, right now it's just that's on the patient. If we're able to let people know that we have this available, that'll be huge. And especially this is no cost. Something I have seen in my line of work is other third-party companies. One would be called Prescription Hope. I'm not sure what else is out there, but these companies offer the same services that, I do at Essentia in the pharmacy, but they charge a recurring fee, which uh, to me it seems like the opposite of what we're trying to achieve. If someone can't afford their medications, they shouldn't be paying for these services. So just more awareness that there are free programs that people can access through their providers and through Essentia and hopefully other clinics as well. And then, like I said, me personally being able to expand to our other markets so we can hopefully reach more people.
Fantastic. Greater awareness is certainly key. Lots of patient education potential there that we can tap into, definitely. Well, thank you so much, Julia, for taking the time to answer some of our viewers' questions. In closing, I'd love to ask for our viewers who may be interested, any advice that you would share for them, people who want to pave a unique career path for themselves in pharmacy and carve that out for themselves the same way you did, whether it be in this niche area that you went into for work or other areas of pharmacy, what would you advise them to do?
I guess if I could give any advice, it would just to be continue doing what you love. I started going back to school, during this process, learning that getting all the education, knowledge you can, and just pursuing what you like. So even though I love pharmacy, I don't necessarily need to be a pharmacist, but I love business too. So just talking and communicating and networking and exposing yourself to new things like MSHP or different clubs and just different areas in the hospital and specifically pharmacy, you'll be able to find something that you like and perhaps even grow a position for yourself similar to like I had.
Absolutely. Following your passion seems to be the key. I've been doing several of these videos, and that is a consistent theme through everyone's responses. Follow what drives you to move forward. Don't follow cookie cutter routes. Don't do what you think is expected of you. You've definitely gone into a niche area that provides you a lot of satisfaction. You're impacting so many patients' lives who otherwise wouldn't be able to afford medications and get the pertinent medication therapies that they need. So thank you so much for what you're doing for the community and for all of your patients. It's certainly appreciated by everyone within the profession and the public. And in closing, do you have any final thoughts, comments, anything else you'd like to share with our viewers regarding your work or your path in pharmacy?
No, I don't think I have anything else to add, but make sure if you do encounter a patient who needs assistance to find the resources available to you and your team. I think we covered the basis of what patient assistance is, at least in pharmacy, and hopefully people have a better understanding of what's available and what they can access for their patients. Thanks for having me, Peria.
Thank you, Julia, for joining us. And thank you all for tuning in to learn more about patient assistance programs and different pharmacy technician career paths. See you next time.